If you use extra-strength analgesic balm for chronic pain, you might think you are only treating your muscles. But when skin acts as a sponge for massive, repeated doses, the consequences can be systemic. Consider a 50-year-old caregiver who arrived at the clinic with rapid, shallow breathing and a racing heart. Her blood was turning into acid. She spent her days lifting patients, leaving her own back in constant agony. To stay functional, she applied 5 tubes of Tiger Balm every day, viewing the balm as harmless relief. Then, the dizziness started. Her body was absorbing methyl salicylate, a chemical cousin to aspirin, in a dose that would overwhelm any system. Because she applied it to such a large surface area so often, the drug bypassed her gut and flooded directly into her bloodstream. This triggered a metabolic crisis, a state where blood becomes too acidic for organs to function. The skin is not a protective shield, it is a gateway. When salicylate levels spiked, her kidneys hit a wall and stopped filtering the acid. Her body was trapped in a toxic loop. She survived with intensive care, but her case serves as a warning about the fine line between therapeutic topical use and systemic poisoning. Salicylate comes from the Latin word for willow tree. It is a reminder that even plant-derived chemicals become dangerous when the dose is too high. This patient recovered, but her kidneys carry the scars of that toxic overload. This case reminds us that over-the-counter labels exist for a reason. Respect the dosage, because your skin is a gateway, not a shield. The takeaway is simple. Topical does not mean harmless. If you are using high-strength analgesics daily, you are essentially taking a systemic dose. Thank you for watching. If you found this case EIA opening, please like this video and share your thoughts in the comments. Follow Anatomy of a Mistake on YouTube, Instagram, and TikTok for more stories like this. This is a composite teaching case for curiosity and education, not a transcript from a real chart, and not personal medical advice. See a licensed clinician about your own symptoms or care.